All right. Well, thank you, Julia, for inviting me today to talk about employee health. A lot of people are probably wondering what in the world is employee health doing talking with infection prevention, but we work very closely together. So employee health. So what do we do? A lot of people look at employee health. Oh yeah, that's where I go get my mass fit or my TB, screening or test every year or my flu shot. But there's a reason we do what we do. In the state of Kentucky, they have regulations for tuberculosis testing for healthcare workers under hospital operations and services. We follow OSHA guidelines, so we're following federal, state, USP 800. While that is pharmacy, we have our hazardous drug program, which we follow, and that's because of the USP 800 and, of course, bloodborne pathogen under the OSHA guidelines. So you're a brand new employee to Norton Healthcare. One of the things you have to do before you start with us is come see us, or before you start with Norton is come see us at Employee Health. That's where we're going to do your TB screening, which includes a quantiferin gold plus a TB risk assessment. If needed, we're going to go ahead and do your mass fit test that day. We do colorblind testing. We do it across the board because we have found that a lot of people change jobs where they didn't need it, now they need it. And if you do any kind of point of care testing, you need it. So whether you're in lab or you're working on the floor. And of course, proof of immunizations or immunity to those MMR, varicella, Tdap, influenza if it's during the season. MMR, we require that you either have documentation of two MMRs or positive titers for the measles, mumps, rubella. Varicella is the same. We require either two vaccines or an immunity or a titer to show immunity. Tdap, we only require one. Even though the recommendation is to get it every 10 years, but we will give you that second one on that 10th year if you need it. And then, of course, the flu shot. We usually start our flu campaign around mid-September, whenever we receive our vaccines. And our deadline is November 1st. We've had a November 1st deadline for, I think, about 6 or 7 years now. Um, and then we end the campaign, we end the flu season on March 31st. And that's when NHSN requires reporting. So that's when we stop giving and requiring the flu shot. And hepatitis B, while it's not required, it is highly recommended for anybody that works with patients and could possibly come in contact with blood or other body fluids. So annually, all annual requirements are due during your birth month. We've been doing that. It'll be about 8 years. I think it'll be 8 years in June. Every every Norton employee is required to do a TB risk assessment. Sometimes people say, well, I don't have patient contact. Well, you're still a healthcare worker, and the state of Kentucky says you need to do it. So we've tried to make it as easy as possible. We send it through my chart so you can fill it out. It comes back to us. We review it and then let you know if you're missing anything. Your mass fit testing needs to be done during your birth month. We do have a couple of exceptions to that. With the growth of Norton Healthcare, we have offices now in Frankfort, Bowling Green, E-Town, numerous offices. So we have made exceptions for them that we have travel teams that actually go to those sites, those areas, and they'll do their mass fit once a year, and then we mark it in their chart that it is done. OSHA requires that it's done each year about the same time. So as long as we're meeting that OSHA requirement, but they still need to do their TB risk assessment during their birth month. Um, this is where we work very closely with infection prevention with our communicable disease exposures. Anytime there's an exposure to anything. Pertussis seems to be our biggest one right now, even though we have had a couple of measles exposures. Um, Pertussis, we do have prophylaxis that we will give anybody who meets the definition of an exposure. Measles and varicella, we don't do a whole lot of workup on because it is required that you have immunity to those for all employees. But if there's ever question that, well, I'm not really sure if I have immunity or I'm not sure, all you have to do, all the employee has to do is reach out to employee health and we will go through it, check, make sure you have immunity. And if for some reason, occasionally we'll come across an employee that's been here for a long time before they were grandfathered in when it was required, then we'll check their titer, make sure they do have immunity. And if not, then we'll go ahead and give them vaccines. And again, like I said, administer any prophylaxis, whether it's pertussis or meningitis or anything along that line. Some miscellaneous things that we do. Uh, if an employee is injured on the job during business hours, they can come to the employee health office. We'll do a basic assessment, any basic first aid, and we will work. Another partner that we work closely with is workers' comp. Um, well, we have a packet that will help make sure that they get it all filled out, make sure their incident report is done, make sure that they do receive the care that they need, and that they have made that contact with workers' comp. Um, Work restrictions. This kind of falls more under, like with COVID. Right now, we are still following that if you've tested positive for COVID, you need to stay home for 5 days from symptom onset. You can come back on day 6, but you need to wear a mask for another 5 days. Um, any other respiratory illness, you need to be fever-free for 24 hours without medication, and symptoms are resolving. If you have diarrhea, you need to be diarrhea-free for 24 hours. We do have policies that go into more depth for a lot of different diseases.
Closer direction. Well, let me just ride around the expressway. I'm going to see the fresh market.
Uh,
Is it one
Lindsay,
off of Taylorsville Road? What's
iPhone.
Taylorsville Road? One where Zachary Keller's in it.
Sorry, go ahead, Mindy.
And then one of our biggest ones that we do is the bloodborne exposure, whether it's a needle or a splash. And we always find with splashes, if people would just wear their PPE, it would eliminate most of our bloodborne exposures. That's all it would take is putting on some PPE, putting on those goggles, before you're doing anything. People don't think about, well, I'm just taking an IV out. We get so many splashes where they take the IV out and the blood splashes up into their face. Um, I know Cindy is on here. She could tell you all kinds of stories about how many times people have been splashed because all they had to do was if they just put their goggles on, they would have been fine. Emptying urine. Um, while unless it has visible blood is not a bloodborne exposure, still think about it. You're emptying urine, it splashes back and gets in your face. That's the last place you want it. So again, just putting that PPE on would eliminate a lot of that. With the bloodborne exposures, though, the employee will come to us. We will make sure they have their Hep B. We will go ahead and do baseline testing for Hep C and HIV if needed. And then we follow up again with them in like the 4 to 6 weeks. And if the source patient is positive and it's a high risk exposure, then we do start them on PEP. So just to kind of wrap up, employee health, when I started a little over 8 years ago, we had 4 offices at Brownsboro, Women's and Children, Audubon, and downtown. We now have 9, which also includes a new hire clinic, which specifically that's all they do is they see new hires. And they stay busy anywhere from 16 to 20 new employees every single day. We are open Monday through Friday, excluding holidays and weekends. But we also do have a on-call nurse that is available 24/7. So even after hours, employees can call and talk to, it's either myself or Ashley Burns, who is our employee health manager, to answer any questions, whether it's an injury, um, a bloodborne exposure, or they have COVID and they're not sure what they're supposed to do when they can go back to work. Or anything along that line. We're always available to our employees. And we've always said that our goal in employee health is to make sure employees are as safe as they can be at work. And while we have put in as many policies and procedures as possible, we have found that still at the end of the day, it's up to the employee whether or not they're going to put that mask on, the appropriate mask, put their goggles on, or follow the right directions to keep themselves safe. Um, I get a lot of questions about that. It's like, well, don't you tell the employees that they need to do this or that? We tell them every year when they're getting their mask fit, this is when you're supposed to wear this. And inadvertently, they won't do it, or they'll come in and we'll say, well, what mask do you wear? Well, I don't know. Well, have you worn it in the past year? Yeah, I just grab whatever's available. And they don't realize that that's putting them as much risk as the employee as their patients. So um, I've been doing employee health now for 11 years. It is definitely not something I expected to do, but I got into it and I actually really enjoy it. I love working with all the different employees and leaders and meeting different contacts and making those relationships and doing everything we can to keep our employees safe. Does anybody have any questions?
So, Mindy, one of the questions that we get a lot is around the requirements for TB testing, TB skin testing. So, can you talk about, so there's the requirements on hire, but then can you talk a little bit about the when else someone should be or what that process should look like?
Definitely. So yes, on hire, everybody gets a quantiferin gold unless you have a history of a positive test. And then we just do the risk assessment and a chest x-ray. But then going forward, we do your TB risk assessment. If when we do your TB risk assessment and you've answered yes and put you into a high risk category, then you get a TB test. If you're exposed and meet the definition of exposure to a TB patient, then we're going to test you as soon as it happens, and then we're going to retest you in, it says 8 to 10 weeks, but we kind of use the 9 week mark from date of exposure. Um, and then, well, that's really the two biggest. If you're in a high risk category after you do your TB risk assessment, and if you've been exposed to a patient with TB without the appropriate PPE. Does that answer your question?
Yeah. So, what about the difference between the TST and the quantiferon gold?
The skin test is actually not even recommended anymore because um, there's a lot of variables with it. Is whoever placed it, did they place it correctly? Whoever's reading it, are they reading it correctly? So we moved to quantiferin gold for everybody. I think it was 2021. It was either the end of 2020 or 2021. I remember it was right during in the middle of the pandemic. Um, but that's why it's just really not recommended to do the skin test anymore because it's just not as reliable. And
And
there's two different blood tests. There's actually quantiferin gold and T-spot. Quantiferin gold, our lab processes those so we can do them in-house, which is a great save and it saves a lot of time. T-spot, we used to do those, but you had to ship them out. It was down south somewhere that we had to ship those to. So there are two different tests.
so one's not necessarily better than the other, just so much as how you can transport them and get them processed then.
Correct. And as far as I know, the quantiferin gold is the only one that's allowed to be done inside of hospitals in their own labs. Now, T-spot may have changed. At one point, you couldn't do T-spot in your own lab, so that's why a lot of the labs went to doing the quantiferin gold. Like I said, that might have changed in the last few years, but that's why a lot of hospitals, I know UK and Baptist do quantiferin golds.
And then what is it that you use for determining exposure to things like pertussis or Neisseria? Like, what's that resource or reference that you guys use?
We use the CDC um, as our reference point. And then, of course, our infectious disease doctors. We'll reach out to them too, but we mostly use the CDC as our reference for what is the definition of an exposure.
Does anybody have any other employee health questions for Mindy? Now's the time. All right. Well, thank you very much, Mindy, for doing Grand Rounds with us today and talking to us about employee health. And of course, if anybody has any questions or concerns, you're always able to reach out to Mindy and her team.
Yes, most definitely. Thank you, Julie. I appreciate it.
Thank you. Bye.
Bye.